Joining us today is Ingrid Johnston, Project Manager at the Australian Institute of Health and Welfare, who will be speaking at IIR's Correctional Services Healthcare Summit, which takes place on the 27th to 28th of October 2010 in Melbourne. Hello Ingrid, nice of you to speak with us today.
Thanks very much.
First of all, how healthy exactly are Australia's prisoners currently, as has been indicated in the first National Data Report?
This report shows that prisoners have poor health compared to the general community. When they're entering prison, they come with higher levels of conditions such as asthma, cardiovascular disease, diabetes, hepatitis B and C, high levels of smoking and risky alcohol use, high levels of use of illicit drugs, and high levels of psychological distress, all more prevalent among people entering prison than in the general population.
How does self-reported health of prison entrants work in practice?
The majority of the data that we gathered in this first data report came from interviews that are conducted with prisoners when they enter prison. So when they are received into the prison, they are given a health assessment, and we basically tapped into that process and gave the nurses another form of questions to fill in. So the prisoners were asked questions about their health, and in that way it was self-reported information.
And how does the health of prison entrants compare with the health of the general Australian community?
In lots of areas, the health of prisoners is poorer than in the general community, with chronic conditions such as asthma, cardiovascular disease and diabetes. There are higher levels in people entering prison than in the general population. With risky health behaviours like smoking and high levels of alcohol consumption and use of illicit drugs, that is all more common among prison entrants than the general population. And also some communicable diseases like hepatitis B and C, which are again more common among the prison population than the general population. People who are entering prison also have far higher levels of psychological distress than is commonly found in the general population. So when they're entering prison, they're arriving with a range of health conditions which are poorer than found in the general community.
You're speaking at IIR's Correctional Services Healthcare Summit, which takes place on the 27th to 28th of October 2010 in Melbourne. What will you be addressing at the event?
I'll basically be introducing this new data collection because it's the first time that we've ever had this national data available. So I'll be providing a bit of an overview of how this collection came to be and what's in it, and then providing some of the main findings from that report.
Ingrid Johnston, many thanks for your time today.
Thank you.